Hey everybody, this is Nicholas Peter. I'm going to be doing a quick little read through of this document from whitehouse.gov. It is opening up America again. So it's just the guidelines that they're putting out there for opening up America again. So the criteria: the data-driven conditions each region or state should satisfy before proceeding to a phased opening. And then preparedness, what states should do to meet the challenges ahead, and then phase guidelines, responsibilities of individuals and employers during all phases and in each specific phase of the opening. So proposed state or regional gating criteria, satisfy before proceeding to phased opening. So symptoms, downward trajectory of influenza-like illnesses reported within a 14-day period, and downward trajectory of COVID-like symptomatic or syndromic cases reported within a 14-day period. So that has to be going down. So the cases, downward trajectory of documented cases within a 14-day period, downward trajectory of positive tests as a percent of total tests within a 14-day period, flat or increasing volume of tests. And so for hospitals, treat all patients without crisis care, and robust testing program in place for at-risk healthcare workers, including emerging antibody testing. So state and local officials may need to tailor the application of these criteria to local circumstances, e.g. metropolitan areas that have suffered severe COVID outbreaks, rural and suburban areas where outbreaks have not occurred or have been mild. Additionally, where appropriate, governors should work on a regional basis to satisfy these criteria and to progress through the phases outlined below. So the core state preparedness responsibilities, so testing and contact tracing, ability to quickly set up safe and efficient screening and testing sites for symptomatic individuals and trace contacts of COVID-19 results or COVID plus results, ability to test syndromic ILI indicated persons for COVID and trace contacts of COVID results. Ensure sentinel surveillance sites are screening for asymptomatic cases and contacts for COVID plus results are traced. Sites operate at locations that serve older individuals, lower income Americans, racial minorities, and Native Americans. Health system capacity, ability to quickly and independently supply sufficient personnel, protective equipment, and critical medical equipment to handle dramatic surge in need. Ability to surge ICU capacity. So the plans: protect the health and safety of workers in critical industries, protect the health and safety of those living and working in high-risk facilities, e.g. senior care facilities, protect employees and users of mass transit, advise citizens regarding the protocols for social distancing and face coverings, monitor conditions and immediately take steps to limit and mitigate any rebounds or outbreaks by restarting a phase or returning to an earlier phase depending on severity. So there's 3 phases. So you can go from 1 to 2 back to 1, or 1 to 3 back to 1. It's just up in the air. So the proposed phase approach, based on up-to-date data and readiness, mitigates risk of resurgence, protects the most vulnerable, implementable on statewide or county-by-county basis at governor's discretion. So guidelines for all phases, individuals. Continue to practice good hygiene. Wash your hands with soap and water or use hand sanitizer, especially after touching frequently used items or surfaces. Avoid touching your face. Sneeze or cough into a tissue or the inside of your elbow. Disinfect frequently used items and surfaces as much as possible. Strongly consider using face coverings while in public, and particularly when using mass transit. So continue to adhere to state and local guidance as well as complementary CDC guidance, particularly with respect to face coverings. People who feel sick should stay at home, do not go to work or school. Contact and follow the advice of your medical provider. So guidelines for all phases, employers. So develop and implement appropriate policies in accordance with federal, state, and local regulations and guidance, and informed by industry practices regarding social distancing and protective equipment, temperature checks, testing, isolating, and contact tracing, sanitation, use and disinfection of common and high traffic areas, and then business travel. So my job that I was working at, social distancing, protective equipment was a thing that they were doing. Temperature checks was what they were starting to implement, which is why I stopped going in. And if I had a high temperature, they would send you home and then try to get a contact a physician to do testing for COVID-19. So yeah, they were doing testing. Obviously sanitation. But monitor workforce for indicative symptoms. Do not allow symptomatic people to physically return to work until cleared by a medical provider. Develop and implement policies and procedures for workforce contact tracing following employee COVID plus test. So phase 1, for states and regions that satisfy the gating criteria. So phase 1, all vulnerable individuals should continue to shelter in place. Members of households with vulnerable residents should be aware that by returning to work or other environments where distancing is not practical, they could carry the virus back home. Precautions should be taken to isolate from vulnerable residents. All individuals, when in public, so parks, outdoor recreation areas, shopping areas, should maximize social distance from others. Social settings of more than 10 people where appropriate distancing may not be practical should be avoided unless precautionary measures are observed. Avoid socializing in groups of more than 10 people in circumstances that do not readily allow for appropriate physical distancing. So receptions, trade shows. Minimize non-essential travel and adhere to CDC guidelines regarding isolation following travel. Each phase of this guidance addresses those aspects of daily life for which restrictions remain appropriate due to COVID. So phase 1, employers. Continue to encourage telework whenever possible and feasible with business operations. If possible, return to work in phases. Close common areas where personnel are likely to congregate and interact, or enforce strict social distancing protocols. So minimize non-essential travel and adhere to CDC guidelines regarding isolation following travel. Strongly consider special accommodations for personnel who are members of a vulnerable population. Next one. So specific types of employers. So schools and organized youth activities, so daycare, camp, that are currently closed should remain closed. Visits to senior living facilities and hospitals should be prohibited. Those who do interact with residents and patients must adhere to strict protocols regarding hygiene. Large venues, sit-down dining, movie theaters, sporting events, places of worship can operate under strict physical distancing protocols. Elective surgeries can resume as clinically appropriate or an outpatient basis as at facilities that adhere to CMS guidelines. Gyms can open if they adhere to strict physical distancing and sanitation protocols. Bars should remain closed. So we got phase 2 for states and regions with no evidence of a rebound and that satisfy the gating criteria a second time. So all vulnerable individuals should continue to shelter in place. Members of households with vulnerable residents should be aware that by returning to work or other environments where distancing is not practical, they could carry the virus back home. Precautions should be taken to isolate from vulnerable residents. All individuals, when in public, so parks, outdoor recreation areas, shopping areas, should maximize physical distance from others. Social settings of more than 50 people, where appropriate, distancing may not be practical, should be avoided unless precautionary measures are observed. So non-essential travel can resume. Continue to encourage telework whenever possible and feasible with business operations. Close common areas where personnel are likely to congregate and interact, or enforce moderate social distancing protocols. So non-essential travel can resume. Strongly consider special accommodations for personnel who are members of a vulnerable population. So schools and organized youth activities, daycare, camp can reopen. Visitors to senior care facilities and hospitals should be prohibited. Those who do interact with residents and patients must adhere to strict protocols regarding hygiene. So large venues, sit-down dining, movie theaters, sporting venues, places of worship can operate under moderate physical distancing protocols. Elective surgeries can resume as clinically appropriate or on an outpatient and inpatient basis at facilities that adhere to CMS guidelines. So gyms can reopen if they adhere to strict physical distancing and sanitation protocols. And bars may operate with diminished standing room capacity where applicable and appropriate. So phase 3 for states and regions with no evidence of a rebound and that satisfy the gating criteria a third time. So vulnerable individuals can resume public interactions, but should practice physical distancing, minimizing exposure to social settings where distancing may not be practical unless precautionary measures are observed. Low-risk populations should consider minimizing time spent in crowded environments. Phase 3, employers resume unrestricted staffing at work sites. So visits to senior care facilities and hospitals can resume. Those who interact with residents and patients must be diligent regarding hygiene. So large venues, sit-down dining, movie theaters, sporting venues, places of worship can operate under limited physical distancing protocols. Gyms can remain open only if they adhere to standard sanitation protocols. Bars may operate with increased standing room occupancy where applicable. So we got the appendix. Just elderly individuals was one. And then individuals with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, obesity, asthma, and those whose immune system is compromised, such as by chemotherapy for cancer and other conditions requiring such therapy. So, yeah, just a really quick read along with these guidelines. So, obviously, like they were saying in the beginning, it's just at the discretion. So let's see where it said that. Yeah, implementable on statewide or county by county basis at governor's discretion. So it's not blanket all the time. This is what's happening forever. It's case by case, county by county, but it's still something that we should be aware of. I'm obviously going to have the link to this in the description, as I always try to do. I always try to have my links. So yeah, let me know what you guys think and what you guys' opinions on it are. So I appreciate you guys watching this, and take care.